Hello and welcome to our Friday webinar. Today we are covering Avian Bornavirus and Avian Ganglioneuritis with our special guests. We've got two important vets in the avian community with us. We've got Dr. Susan Orosz and Dr. Bob Dahlhausen. So welcome, guys.
Hello.
Welcome, Laura.
Hi.
Hey.
And I'm going to also say welcome, Brenda.
And Brenda
And
behind
Brenda
the scenes.
also,
Brenda.
yes.
Hiding in the back, yeah.
Her due credit. So welcome. And wow, okay, so we have a lot of territory to cover, and you guys have been so generous with your time to give us not 1 hour, but two hours of covering this important topic. So we also have, let's see, is this our third time revisiting this, right?
Yeah. Yeah.
So we're gonna go
Fourth.
over.
Isn't it
third?
fourth?
Well, we tried another time, but you
remember,
were stuck in airport, so we had to reschedule, right?
So can I say something first?
Absolutely.
Okay, before we get to the questions, Brenda and I were talking before this started. And so one of the things that I want to point out to everybody was something that Bob had talked about the last time. And let's pretend my fingers are the nerve casings in the brain or the spinal cord. And what happens is that I'm going to use a big word, but I'll tell you what it means. So this virus, Bornavirus, is a neurotropic virus. That means that it likes the nervous system. And so when it goes in there, and my theory is that it particularly likes to get involved and attack the nervous system when birds have their hormonal time of year, then that virus goes after that nerve tissue. So normally the body sees this, right? But because the nerves get disrupted, the axons get disrupted by this virus, and it's replicating because it's going to sit there and then it's going to start replicating when the hormones become elevated, the reproductive hormones. Then it exposes these other glycoproteins. So the virus itself is causing this effect of exposing these proteins, and then the body goes after those exposed glycoproteins. Now, what Bob was also trying to tell you, Dr. Bob was telling you, was that it doesn't have to just be Bornavirus. Sure, most of the time it can be, but there are other organisms, bacteria and other viruses that can expose those as well. And any of those, if it exposes the same, there's a whole bunch of different glycoproteins, and some want to stay in one area of the brain and some are in another area of the brain. And all of that then contributes to, sometimes it's Borna positive and sometimes it's not Borna positive, and yet there are symptoms. And that's why the AGAA test helps us to see if we have circulating antibodies because of those glycoproteins that get exposed. Some of them, not all of them. Is that okay, Bob? Did I?
Yeah, that's correct, Susan. As far as Bornavirus goes, though, that virus hides out in the cell nucleus. And when it does circulate, it circulates at a very low level. And most of the time that virus lays dormant in that cell. So when you mention testing for Bornavirus, I mean, that's, false negatives are pretty common because of that. But for the AGA, that antibody is going to sit around for a lot longer period of time. It's an IgG antibody, and they're pretty long lasting. So you're better off picking that up to know if you've got a case of avian ganglioneuritis versus just testing for Bornavirus itself. That's correct.
And I know that was one of the questions later. So you want to probably do the share screen thing now, and
that's right. Yeah, you have a presentation for us.
Okay, so we were emailed a group of questions that came from the last seminar, and I think from this PDD Facebook group. And so what I did was put them up on the screen. I'll try to get these up, and they're they're in somewhat of an order, but not completely. So let me do this and see
while you do that, I'm just going to remind
go ahead.
If you have a question, we'll try to get to it later, but use the Q&A button to submit it and not the chat feature.
Okay, this is blocking me to see where I can start it from. So let's just.
I can see the screen share. That's good.
Yeah, I know, but the problem is I can't get up here to start the presentation.
Oh, to start the
because this is blocking it. Let me see if I can reduce it. Maybe. Nope. Give me a second. Keep talking.
All right. I mean, it's just it's amazing. All those
we can
questions
see it, but if you put your view over to the other corner.
How's that?
Yeah, that's fine.
Yep,
that'll work.
That works.
Okay, we got it up there.
Perfect.
Do you see my Zoom toolbar in a way?
No.
Okay.
You're good.
Okay, so again, these are the questions that were submitted, and then we'll follow up with other questions after this as they submit them during this webinar. But it started off with a question here for you, Susan.
Yeah. Okay.
Talking about ABV testing.
So, and I think this kind of goes along with a question that I was asked by somebody yesterday. I do still test, unlike what Bob tells me to do. Sometimes I follow what he says, and sometimes I don't. but I think I tend to try, if I can, to do the Bornavirus test and the AGAA. I think as a clinician, I like to have that piece of information that I could potentially use in the future. So I said the word in the future. And,
correct.
And so I had a lovely owner yesterday with a Bloom Gold Macaw that is feather plucking, which we'll probably get into in a minute because someone's going to ask about feather plucking and Bornavirus and AGAA. So the assumption by her bird group is that, if they didn't even let it determine if it's going to be positive or not. They just decided that the bird's going to die in a year. So the point is, that's not true. I mean, there are some very sick birds and they die. I mean, and Bob and I saw a lot of that in the early 2000s. And I believe that this virus is transforming itself over time because viruses don't want their host to die, right?
No, the virus will die out if the host dies.
Right.
So the virus is adapted to the host. So
it's adapting. So I try to minimize stressors. I try to minimize hormonal behavior. And sometimes when the symptoms are very difficult for the owner and the bird to deal with, this is when I use things like, I try to do behavior modification as best I can, but then sometimes I'm going to use Depolupron or Desorelan. And then I'm not sure, Bob, do you understand what they mean by, believe some strains of ABV itself can cause some form of clinical disease? The virus itself, because it's neurotropic, it alters those, like I was saying, those glycoproteins. It exposes glycoproteins. So the virus is causing that exposure. And then, see, it isn't like you getting a cold because somebody sitting next to you had the cold, and so they transferred it to you. And we knew that we should have had our thinking caps on in the beginning, because how do we describe this virus? Well, we didn't know it was a virus. We assumed it was a virus, and we said lymphocytic, plasmacytic ganglioneuritis.
Correct.
Okay, so we're talking lymphocytes. We're talking about T lymphocytes. So the body is reacting to itself.
Exactly.
And so that is the hallmark of this. It isn't like, you know, people would say to me, oh, that's wrong. We had one bird die from it, and then we went and we tested all the birds in the room. And as Bob knows the answer to that, about 40% of them are going to be positive, right? And they say, there's a bunch of them that are positive. It's running through my flock. Maybe, maybe not. Maybe they sat there all along and they were positive all along. You just didn't know it. Okay, so that's how I would talk to you about number one. Okay, next.
Okay, it says we know PABV2 and 4 associated with the possibility of avian ganglioneuritis. Older studies in Europe found the vast majority of birds with ABV had PABV2 or 4. Do you recommend genotyping positive birds? The genotyping really is not routinely available.
Okay.
Basically, it can be done in real special situations, or again, if you're doing research, but it's basically going to require sequencing of the positive test sample. And then routinely, that's just not really, you know, available. Regarding these comments about some strains of Bornavirus, I think at this point in time, any bird infected with Bornavirus, regardless of the strain, it's got the ability to expose those ganglioside proteins. There was a real interesting study done with mammalian Bornavirus where they inoculated rats, and in one of the extremities, I think it was in the leg or the foot, and if they had severed the nerves coming off that area, the virus would not be transmitted to the central nervous system. But if those nerves were intact, the virus would go to the CNS in these laboratory animals. So I think what that shows, and we know this from some of these other studies on infectivity, Bornavirus is not one of these viruses that, like you mentioned, this aviary situation, that's going to pass from bird to bird. You know, we know that ingestion or inhalation of the virus is not a suitable means of transmission of Bornavirus. Most of the birds that are positive with it actually were hatched out with it due to vertical transmission, which I think is one of the major routes of transmission of the virus. We can only artificially induce this disease if we inoculate the virus, either through injection or, you know, intravenous or intramuscular injection. And getting back to the strain of Bornavirus, as is virus, I think this virus does travel up through these nerves, and in doing so can expose these ganglioside proteins. So I don't think it's really important to know whether you're dealing with PABV 2 or 4. I think we just need to know the bird's has Bornavirus itself. So, and I'm going to try to advance this if I can. Let's see here. There we go. This just shows where we're at with Bornavirus. We've got 15 genotypes and we're counting. And, you know, for citizens, it's not only 2 and 4, but there's a 1, 3, and 7. And we have a number of passerine Bornaviruses and the finch Bornavirus and the waterbird Bornavirus. And then we've got 5, 6, and 8, which really haven't really been classified yet. So, you know, I think we have a lot to learn about these different genotypes. But as far as what value would that offer to you as an aviculturalist or a veterinarian treating a bird with Bornavirus, I think at this point in time, it probably is not going to help very much. Okay, so our next question.
So I can talk about this for a second, Bob, is that obviously when you and I were very involved in the early 2000s, we had a lot of birds that were dying.
Correct.
And a necropsy is really important. Now, at our veterinary hospital, we if we have that particular bird as a client, a current client, or a current patient, where that bird is under our care, and we're very concerned about it, we don't charge to do a gross necropsy. If there's going to be tissues submitted,
we do the
then we
same
charge
thing.
for that. Yeah.
And
So,
if it's a case of research interest, we'll just charge them what our cost is, what the pathologist charges us, because that's how we learn, that's how we contribute
Right.
to our knowledge base. Agreed.
And let me just tell you that it's really important, when your bird passes away, and I know it's very traumatic when your bird passes away. It's just bad, but it helps us as veterinarians help the next bird. So
exactly,
it's important to preserve the body and get it to the veterinarian right away. So you want to wet it down. You want to wrap it in a towel, and then a plastic, and then get it in the refrigerator. Get it cooled down as fast as possible, because the GI tract notoriously, along with the brain, autolyzes or decomposes very quickly. So in order to get good information and important information, we have to have the body done in that way, in that 24-hour span of time. And then I guess the question that they are asking about is AGAA, too many false positives.
Yeah, I have not heard that. I'll tell you what I have heard was that Bornavirus testing has too many false positives. And I know some of the other labs out there have criticized us for that, but I'd like to make a comment on that. Let's see if I can go to the next slide here. When we talk about Bornaviral infection rates, we know it is widely distributed, both in captive birds in Europe and the US and in the wild populations. Michael Lertz in Germany took 59 healthy birds that were coming into the clinic for just a normal yearly checkup. He tested those birds, 27 out of 59, which is a 45.8% positive rate for Bornavirus. Okay, and again, these are normal, healthy birds. We had an aviary with known PDD, 77 birds, 35 of those were positive. Again, 45%. That's a pretty high rate. At the lab, we took 791 blood samples and swab samples that had come in for other testing, not for Bornavirus. 271 of those were positive. That gave us a 34% positivity rate here in the US. And then when there was a report about a wide-scale survey in Europe of different aviaries, they had a 23% rate. So basically, on the average, you've got about a 30% positivity rate, and Bornavirus is present. If you got 3 birds or more, you've got Bornavirus in it, chances are. And in order to pick up Bornavirus, you got to keep a couple things in mind when we test for it. Number one, the virus is very, very friable. You can have a positive test. It's a very positive test today, and come back and retest that sample 7 days later, and it will be negative. And that's because this virus is not stable in the environment. There was a viability study that was presented at AAV a number of years back, and they theorized that the virus maintains its viability for about 6 hours outside of the bird. So again, this transmission from bird to bird, we really have to, this is not like, say, beacon feather or Pacheco's virus. This virus just really is more transmitted from, through the egg rather than from bird to bird. And getting back to testing, again, we're hitting about a 34%, I'm sorry, test rate in our lab. And these were samples that were not submitted for Bornavirus testing. And that really is in line with what's been reported, it's actually a little bit lower. And so this criticism about, oh, there's too many false positives. I really think the problem here is there are too many false negatives. Number one, if the sample is old, you're going to get a negative sample. Secondly, there is not one test that will pick up all the different genotypes of Bornavirus. And really, to be sure that a bird is negative or that sample is negative, there are 3 different PCRs that need to be run on that sample. And then you add to the fact that the virus is intermittently shed. You really need to take a sample from that bird, blood and swab, cloacal swab, and you need to do 1 sample every 2 weeks. If you have 3 negative tests, okay, 2 weeks apart, and each time you tested with the 3 different PCRs, so all those 9 tests are negative, then I would say you've got a pretty good chance of saying that that bird is not infected. But again, this criticism about false positives with Bornavirus, I think it's a problem because, number one, there is no uniform testing protocol out there. These veterinary laboratories doing avian samples, there is no, like in human medicine, you have CLIA, you've got the FDA and that, and there's no controlling body that accredits these laboratories. Voluntarily, you can join the, there's a veterinary laboratory diagnosticians group, but this is more for farm animals and pet animals. They do nothing really for birds other than poultry. So again, anybody can go out and set up a test. We don't know what these other labs are doing, but I really feel that this criticism about there's too many false positives for Bornavirus. Again, if you get a positive, I really put a lot of faith in that positive. You get a negative, that I really don't believe that bird is negative unless you run it through this protocol that I described. Okay. Susan, any comments?
I would absolutely agree. And, we spent a lot of time in the early 2000s between the two of us, with me sending samples from all these birds that were dying. So we realized, that you have the one situation where you have birds that are dying and it looks and smells like PDD. And then you have the bird that comes into your clinic that is normal. And that's where, you're saying the thing that with that bird that's doing poorly, it's an important thing to differentiate if it's got a neurologic problem. Is the AGAA test positive? Because we want to put that on our, as we would call it, we want to put it on our differential list.
Yes.
But there are other reasons. I mean, that's, we were just talking about that before we started here today. We have some veterinarians that go, now they're saying, yeah, it used to be when it had feather damaging behavior, because I'd given this lecture about the brain. They said, oh, the brain screwed up. And then they throw their hands up in the air and then that's the end of that. And they think that's it. And we're going to go on. And I don't know, I can't help you with your bird. So now the next thing is, if there's a neurologic problem that's consistent, well, maybe even not consistent with Bornavirus, they go, oh, that's Bornavirus. And then that's the end of that. But heart disease and all these other things can be part of that differential list. And it's the clinician who has to work hard at trying to come up with a diagnosis and a treatment plan. And that's where we have to be concerned about.
I agree. I mean, too often we just want to pigeonhole a diagnosis. And I think there's a question later on here about heart disease and that in a bird.
I saw this. Bob, what is HMT?
I don't know. I was going to ask that because that's how it was presented. It says, given molecular mimicry, is HMT something that can cause positive AGA and symptomatic avian ganglioneuritis? I answered that yes, with a possibility. I'm not sure what they're talking about, HMT, But I put this slide up here because we do know that, as you alluded to, other infections can
Right.
cause this. And
Right.
these are like with mycoplasma, the antibodies will cross-react with GM1, Haemophilus GM1, GT1B. Paramyxovirus is so similar to Bornavirus. In fact, there's actually been a paper published that describes and shows the, in the genome, the similarity between these two viruses. So,
Which is, for the viewers, that's a problem, right? Because
exactly.
because they may not understand that, but paramyxovirus is the virus that is involved with exotic Newcastle's disease, or can be. And
Yes.
so that's a federal reportable disease. So so that's an interesting, so she said heavy metal toxicosis. Go back.
Oh, is that it? Heavy?
Yeah,
Oh,
heavy metal.
okay. Let me back
Go
up
back to
here.
the question.
No, it won't. Let me change it.
No, heavy metal won't cause
no,
it. No.
No, absolutely not. Nope. I got to go back here. There we go. No, but you got to understand one thing. If this bird is stressed from the heavy metal toxicosis, or as I think we allude to, heart disease here, stress can activate Bornavirus in a bird that has it and cause then a positive AGAA.
Right.
And so that's why, again, your comment about really working up a diagnosis and your differential list.
Yeah, I want to talk about that.
Okay, go ahead.
Okay, so with heavy metal toxicity, this is a thing that I always work with my residents on. Okay, so they're alluding to signs of proventricular dilatation disease, and this I can tell that from this question. Okay, so if you have a bird that has heavy metal toxicosis and they've had exposure of iron, maybe they have it, but the pieces of metal have passed out of the GI tract.
Exactly.
So what I've always said to my residents, okay, tell me if this is going to be a Bornavirus bird. So we know that the proventriculus, we have the same type of symptoms. Because in that the proventriculus and the ventriculus are not working properly. How do I know that it's heavy metal, or how do I know that it's Bornavirus? And I say, I take them and I draw them over to the X-ray and I go, tell me, how can you tell? And the point is, the wall of the proventriculus is going to be normal with heavy metal. It's going to be thinned with proventricular dilatation disease.
Correct. And if you just run a basic CBC, you
yeah,
ought to be able to pick up heavy metal toxicity. You're going to see immature red blood cells. You're going to see reduced hematocrit. And with Bornavirus, Avian Ganglioneuritis, usually these blood tests are normal.
Until things go really bad.
Until the bird is real bad.
Really
That's
bad.
correct.
Right. Okay, next
Agreed.
question, Bob.
Okay, let's see here. Okay, this was the one that talked about arteriosclerosis and AG can be similar. Some birds in the group are found to have positive AGA.
No. So the answer is, so the atherosclerotic plaque is atherosclerotic plaque, and it's causing alteration in the heart and the heart muscle, because the heart has to push harder to get through this narrow luminal tube. Okay, so you have heart disease from that situation, or you just have basic heart disease because as the bird is aging, there's a lot of factors going on. So you have some heart disease, and you may not have really nice defined atherosclerotic plaque. You may or may not have that, but with Bornavirus, let me stop for a second. So in either situations, you can have a thinning of the breast muscle, but it's going to, but the heart disease is not going to be to the extent that you typically see with bornaviral disease, because if the bornavirus is affecting the muscles to the pectoral mass, because, and we saw that picture you had of brain, where they show the virus affecting those ventral horn cells, then you have neurotropic atrophy. The muscles are extremely thin, and it's more likely than that Bornavirus is playing a role in that. Now, there are times, I will admit, that it's blurred and you can't distinguish.
I agree. And this question here, can arthrosclerosis cause a positive AGA?
No.
No, absolutely not. But again, stress from that disease
Yep.
can activate Bornavirus and then produce a positive AGA.
Right, and you can't have neurologic signs because of heart disease, not because it's Bornavirus. So this is why I said in the beginning that the veterinarian has to be a sleuther. He can't just pigeonhole and say, oh, throw up his hand, oh yeah, it's neurologic, it's gotta be Bornavirus. Yeah, it could be heart disease. It could be just heart disease. Bornavirus has nothing to do with it. Okay, next one.
Okay. Dr. Rico Soga in Japan asked, where can I get an assay for neuroantibody testing? Well, in the US, you're going to, an import permit is required to import the samples, and these can take time to obtain. We actually just were granted an import permit to bring some research samples in from Germany, but a blanket permit really isn't granted. So basically every sample you want to send in, you're going to have to tell them you're bringing it in. And so it's really not practical. Italy, the AGAA test was developed by Giacomo Rossi and Dr. Livio Galozzi at the University of Camerino. And I know they are offering the testing, and it's a lot easier to get samples into Europe, into Italy, from the EU and possibly from Japan. So I would highly suggest that you contact them. If you cannot get the samples in there, you may want to still talk to Dr. Rossi about possibly licensing this assay, for use in Japan. And those arrangements, probably could be made. That's what, excuse me, that's what we did here in the US. And again, it's licensed and it is a patented under a world and US patent. So, okay, Susan, I'm losing my voice. Go ahead, I'll let you go on this
so
one.
Here's a long one. 22-year-old cockatiel had a follow-up x-ray a few months ago for something unrelated, and his vet thinks his proventriculus is slightly, a 22-year-old, slightly widened. He had mild weakness in his left leg for over a year, no other symptoms. He's had a broken, dislocated left foot as a chick that was never fixed. So the left foot is mangled, and he's been walking on that for 22 years. She started him on Loxicam, which she thinks, she doesn't read, that avian ganglioneuritis was right what you said. He was immediately better after his first dose. Most likely he's got arthritis. And so the only thing for AGN is the x-ray finding, which I'm dubious about. Any thoughts about the x-ray? So this brings up the same thing that we've been talking about before, is that that's where the veterinarian has to really delve much deeper than a casual thought. This proventriculus can be slightly widened because he's 22 years old.
22-year-old bird, I mean,
yeah,
come on.
As an older bird, just in general, older birds, the GI tract wants to slow down. He could have a low-grade bacterial infection, because of his age and his immune system. I mean, there's a lot of potential things. And Bob, you and I have had a lot of people ask us essentially this, where they want to look at that proventriculus and say, oh, it's got to be Bornavirus. But I would do gram stains, crop GI, fecal, and keep an eye on him, because I bet he has a low-grade bacterial infection. He's got Clostridium and some anaerobes in there. So,
I would,
he has that, and he has arthritis. Let's put it that way.
yeah, I would agree with the arthritis in that. And you cannot base a diagnosis of avian ganglioneuritis on this, just this one
that,
little
yeah.
finding, slightly widened. I mean, this is a 22-year-old cockatiel. I mean, I'm 70 years old. My muscles are getting weak too. So with old
So,
age,
and the
these
other
things
thing that I
happen,
want, yeah, the other thing I want to say about this, which launches us into a new subject, is that you can use meloxicam for a fairly long period of time. It's also important that the veterinarian makes sure that they use, the dose of meloxicam has changed over time. And so it's about 1.5, 1.6 mg per kg twice a day, which is pretty high. So essentially, if you're using the oral form of it, it's essentially the weight of the cocktail. So in kilos, so if let's say the bird weighed 100 grams, so it'd be 0.1 kilos. Well, you'd give it 1/10 of a mil of your meloxicam twice a day, as an example. Now, from an herbal, this is kind of off the subject, but still people will be interested in this. So what we try to do at our veterinary clinic is we start them there, but then we try to do other things, because we don't want to keep them on meloxicam. And that's going to come up later about Celebrex. We don't want to keep them on there forever. So that's when we start using some herbal medicine on them. So I think we're ready for the next one, don't you think?
Yep, here we go. 15-year-old Congo African gray, possible GI symptoms 12 years ago. It's regurgitation, hospitalization for, several weeks, questionable barium study. Went 12 years in perfect health, well checks and hormone injections, Lupron. In June, she had a prolonged focal seizure, 3 to 4 days post-ictal, loss of balance, coordination, difficulty, loss of grip strength. Normal calcium, no heavy metal toxicity. She was stressed from my traveling and hormonal, treated for 1 to 2 weeks. They don't say with what, but symptom-free, stopped medication, decided to have AGAA, performed in August, positive, previously ABV positive. My avian vet just retires, thinks she has relapsing avian ganglioneuritis. Our new avian vet is not convinced and thinks something else could have caused the positive AGAA. Is it possible to go 12, 12 years in between symptoms? Also given yes. Okay. This virus has developed a number of mechanisms to evade the host immune system. And the fact that it hangs out in the cell nucleus kind of protects it. And we know that Bornavirus, at least up to this point, everything is shown it's very similar to a herpes virus. Once infected, you're infected for life. The bird's infected for life. The fact here that this bird was stressed, it was hormonal. You've got a number of different factors here. The seizures, that is probably one common sign that we will see in birds that have avian ganglioneuritis in Congo African grays. In fact, when I see grays come in with seizures, it's my 2 top differentials are ganglioneuritis and heavy metal. And most
then heart disease is third.
Yeah, heart disease is up there too. Most of the time it's ganglioneuritis or heart disease. So this new avian vet is not convinced that something else could have caused a positive AGAA. Yeah, going back to the molecular mimicry and some of these other viruses, it is possible. Bottom line is this bird should probably be treated the same. Can it go 12 years in between symptoms? Yes. Because the infection is for life. I had an Amazon parrot that the owners finished hand raising. It was the only bird in the household. They had it for 18 years. At 18 years of age, the bird broke with Bornavirus disease or avian ganglioneuritis. So again, they can go a long time before they actually show clinical disease. Comparing antibody levels, that's something we're looking at right now. I've got a computer program we're working on to standardize from test to test. And again, I think as we accumulate more information, we're better able to say, there's this, the level is here. What does a decreasing level mean? What does an increasing level mean with the AGAA? But that's down the road. We're working on it.
Yeah, but I think the point remains is that if it's positive, as a clinician, you still need to think about that in treating these seizures, that we need to think about that. So let's pretend I was that clinician, although I'm not young.
Yeah, I wish we were.
So we're not retiring yet, Bob, but this is one where I would be asking the question, is it seizuring around the time that the behaviors are suggestive of hormones are being elevated, the gonadal-hormones. So if we know that it's happening at a certain time of the year, let's think about, behavior modification to try to change that. Let's try to do some things to help reduce
the stress. Yes.
Reduce the stress and the hormones during that period of time. And then we might just, for a couple months, put it on Celebrex if that keeps the bird, or Keppra, depending on the situation, but not keep it on all the time. I don't like to keep birds on non-steroidals for long periods of time, even though they have a kidney that's really designed like a reptile. Okay, I guess we should go on.
What other conditions other than avian ganglioneuritis can cause a positive AGAA? Well, actually, it's the AGAA that causes a ganglioneuritis. So we've talked about this. We talked about those other agents. Detects autoantibodies directed towards the neuroganglioside proteins. False positivity on any serological testing can occur from non-specific reactivity from the donor IgG. But,
and remember, we have that issue. So for people here, this was really designed for parrots because you had to use chicken sera.
Correct.
So you can't say this and use it for chickens.
We can't use the test on chickens. Yeah.
Right.
And that is a whole nother dilemma because we've had chickens that are positive for Bornavirus, and I don't think the poultry industry is aware of this yet. So, but luckily,
exactly.
If
pigeons too,
Yes.
Pigeons. Yep.
Well, if you look at the number of different species that Bornavirus has been found in, I mean, there's a wide range of avian species, from waterfowl and raptors and citizens and passerines and so forth. So it's not unlikely that we will find it in poultry and pigeons. So
hey, I'm going to ask a question, Laura. If somebody raises their hand, can you check and see if it's relating to what we're talking about right now and kind of chime in with that question?
I can try. Yes. Let's see here. Yeah.
Because
that's funny when you said that. I got 3 hands
to do that yet. Okay.
Okay. Let me see here. I'll work on that behind the scenes here.
Okay.
So the next question is talking about the difference in symptoms between species. Why do some birds get worse than others? And I think just basically, we know that the disease that we observe is dependent upon the gangliosides that are recognized by the host immune system. And there's over 50 of these different gangliosides in the body. And so it's going to depend on the neurological distribution of these gangliosides in the host, what gangliosides are recognized, and the severity of that immune reaction. And I think the more we look into this and we start doing testing, and we've got the ability to run ELISAs right now for specific neurogangliosides, GM1, GT1B, and so forth. I think we're going to find that we have a different distribution of these certain gangliosides among species. And that is probably going to explain why Say
I
with
agree.
African grays, we see seizures or, mutilation. With New World birds, we tend to see GI tract signs and so forth, or this ataxia that, and proprioceptive deficits, lower brainstem signs that we see in cockatoos. And again, this is research down the road that we need to do, but having the ability to, differentiate between these different gangliosides and what the antibody is directed to. And then if we can do in situ hybridization for specific gangliosides in different regions of the central and peripheral nervous system among different species of birds, I think that's going to give us a lot of information.
Right. And that's what you're saying here.
Right.
Without kind of belaboring the point, is that different parts of the nervous system have different ganglia proteins and and they differ also in species of birds. And that's why New World and Old World are different. Yep.
Yeah. And just a summary here, Old World species, we tend to see more central nervous system signs. New World species, autonomic nervous system, gastrointestinal, and so forth. African gray parrots, central nervous system, peripheral nervous system. So again, it's the distribution of lesions, where are they located, and the severity of the lesions, which is going to determine the clinical disease that we observe in the infected bird. Okay. Our hawk-headed.
Yeah, you probably know about hawkheads because you probably have better data on that. But I would say that some of them are. I mean, there's a small group of birds that came in the United States. What do you find, Bob?
Well, we're not seeing as many hawkheads as we used to years ago.
Okay.
But I would say that they're probably no different than any of the other Amazons. We don't see a lot of avian ganglioneuritis in Amazon parrots, but it is present. And I wouldn't think that they're much different than what we observe in the Amazon species in general. Parrotlets, we have seen it. Problem with parrotlets is that these are little tiny birds. They have very, very low body reserve capacity. When these birds get sick, I mean, they will drop off the cliff really quick. And so it's a real challenge. And I would say to anybody, if you have a parrotlet, you suspect it, I would do everything I could to get that bird on treatment, regardless how severely it's affected, because these birds will go south very, very fast.
Well, I mean, when you talk about differentials of parrotlets, the first thing I do, because heavy metal toxicosis,
yes,
they're always put into budgie cages, and they got those big jaws, and they have heavy metal
and all the toys,
until proven otherwise. And then the second thing that they always have until proven otherwise is they have avian gastric yeast. I mean, they very commonly have avian gastric yeast. So some of these things, are there's a lot of different things. Different bird species tend to get different things, but those are some of the things I think about.
I agree. Absolutely. My 3 birds, 2 Camelot macaws and a Moluccan, all were tested by sending samples overnight to us. They were all positive. I don't know if that was for AGA. I'm assuming since it was overnight, it was probably for Avian Bornavirus. One was put on Onsior injections. May 2021, is still on Onsior. So it's been on Onsior for
over a year.
Yeah. 2 other birds were tested later. Okay. Since injections are stressful, those 2 are on celecoxib. How long should Onsior and Celebrex be given? These birds are bolstered by colostrum. I don't know where they're getting that from in VisBiome. VisBiome's a great product. The macaw has been tested twice. Cloaca was 2 inches longer than it should be until Onsior. None of the birds have trouble digesting food. I'm a little confused by this because I don't know if they really ran an AGA antibody or if they ran an avian Bornavirus. If they were Bornavirus positive, I cannot really, that to me, that's not justification to put the birds on treatment. Only if you have clinical disease that can be
Okay.
related to avian ganglioneuritis, then
Except
treatment
they
is
talked about
justified.
this cloaca. Now, the question that we're having trouble finding out from them is, was there big, heavy stools? Was there cloacal prolapsing? We don't know the answer to that. But I think the question that Bob, that you and I should talk about is, how long do you leave them on? And you've alluded to the fact that you're going to leave them on related to their symptomatology.
Exactly. Yeah, I don't agree with keeping birds on any of these medications. Again, I think Celebrex is probably a lot safer than meloxicam. Celebrex is a pure COX-2 inhibitor. Meloxicam is a preferential COX-2 inhibitor. It does inhibit COX-1, which is the, that's the enzyme that helps with the GI protectant and blood clotting and so forth. So, over a long period of time, I'd be very reluctant to keep a bird on meloxicam. But that being said, even Celebrex or Onsia or robenacoxib injections, you use these medications when you have clinical symptoms or signs, actually clinical signs, that can be related to avian ganglioneuritis, especially in a bird that has a positive AGAA. But they're really not going to do anything for a bird that is non-symptomatic, that is avian Bornavirus positive. And so that is not justification for their use.
Great, agreed.
Okay.
I also have, as you go to the next one, I also want to make the comment that I try to get that bird off of the use of Celebrex or Onsia, or I like to do it within a 2-month period of time.
Agreed. Okay, as parrot owners and avian vets are becoming more familiar with avian ganglioneuritis, it appears it's a go-to diagnosis when no other cause can be found for symptoms. In the AG support group, several birds with presumed avian ganglioneuritis are found on necropsy histo to not have avian ganglioneuritis. Well, I mean, that's to be expected, because as we discussed, cardiac disease, arteriosclerosis, heavy metal toxicity, number of infections from other agents can produce signs that are very, that are compatible with avian ganglioneuritis clinically. Again,
and then I'm going to add a caveat to that. Can I add that I'm going to play the devil's advocate here?
Sure.
So, and that is, how do you know the pathologist is correct? Because many pathologists don't do fine, detailed, serial section necropsies of tissues, so they may have missed it. And certainly when it comes to the brain, they could miss it. If it's not proventricular dilatation disease, they could miss it.
I agree, and this has been a real concern that both yourself and I have had.
Yeah, when we try to send samples in, we
send a brain in, it'll do a section, and we have no idea where the lesion was found. They don't section it completely through. You may have a section in the lower brainstem in the Purkinje cells or something, and they section the brain through the cerebrum and say there's no CNS signs. And that has been a real problem. We need a pathologist who's a neuroanatomist for avian to do this. So Susan, that's going to be your next career, okay?
No, Scott already has me on another career, going back to anatomy. Oh boy.
Well, when they talk about presumed avian ganglioneuritis, again, presumed, you probably should confirm that with the antibody level. And again, these birds can have this Bornavirus or, and again, one of these other agents, and then due to stress from some other disease entity, this can flare up, and then avian ganglioneuritis can complicate it. I had an African gray parrot, perfectly healthy looking bird, great body weight in that, had one little spot over the left side of its thorax that it picked at. And it started this within, about a month. And all of a sudden, this bird literally fell off the perch dead. We went ahead and did a complete histopathology on that bird. The lesions of the lymphocytic ganglioneuritis, lymphocytic plasmacytic ganglioneuritis, were observed in the Purkinje pathway in the heart, the conductive pathway of the heart, the pathway that conducts the electrical signals to make the heart beat. That was the only place we found lesions. So when we say a necropsy, they not to have avian ganglioneuritis, I really have to question, if you don't do a very complete necropsy with serial sections through the central nervous system and all these other tissues, you cannot rule avian ganglioneuritis out because it can be very focal in nature. Okay, next one. My Eclectus has toe tapping and chewing on one of his toes. He's ABV positive, but tested negative for the antibody. Onset of tapping was during the breeding season. He was very hormonal. Can the antibody test be negative if we waited too long to test? So I've been tapping for 3 months now, but notice the tapping has decreased in the last week. For the most part, if he's got avian ganglioneuritis, the antibody test will show positive. We've had some instances where we've had full-blown disease where when these birds are so emaciated and their immune systems just aren't functioning, some of those birds, and it's a pretty rare situation, I've discussed this with Dr. Rossi, some of these birds will have a negative antibody test. As far as this Eclectus goes, and there's been a lot of theories about this. I heard excess vitamin A in the diet and so forth. Bottom line, Eclectus, and I'm talking from a clinical standpoint, they're very, very sensitive birds, and they will do this in response to, allergies, inhalation allergies. We're in the Ohio River Valley. We've got a lot of molds in the air, a lot of pollen in the spring and fall. We'll see an onset of this toe tapping in Eclectus's parrots. We'll see it with heavy metal toxicity. I don't believe it really is a vitamin A toxicity. Yes, you can produce it, but with the majority of the diets that are on the market, it's going to be, I don't think it's possible really to develop vitamin A toxicity if they're on a regular diet, at least as far as the Lafeber products go. Vitamin A toxicity just it really is not a factor there. So again, I would recommend with a toe tapping bird, and again, with the fact that when they become hormonal, a lot of these other clinical signs will tend to be exacerbated. This bird needs a really complete workup, a good CBC, gram stains, and so forth. CBC is so important, and a lot of these commercial labs that they do dogs and cats, and they do birds as kind of an aside, an add-on. For years, I've sent samples out to these commercial labs, and the results I got back were very, very incomplete to what I was seeing under the microscope. And for that reason, we do most of ours in-house. Although if we send them out, we send them to Rosalie Lane, because Rosalie's been doing this for like 40 some odd years. She was actually one of the first clinical labs doing avian samples, and I trust her judgment on it too. What I don't trust is some of these big laboratories that are running, bulk samples of dogs and cats, and then they get a bird sample in and they run it right through, because I just don't think we have the attention paid to these avian clinical samples. And that's why we tend to do them in-house. How about you, Susan?
Yeah, we also, I'm old, so we do them in-house. So there's that MyCore group that is doing things now. And so the thing that I would absolutely agree with you, that they're very exquisitely sensitive birds to things.
Correct. Yes.
And those could be allergens. It can be certain types of chemicals, and so you taught me how to go back and really look at those red blood cells, to kind of figure out some of what was happening. Oftentimes when they're, so as we know that when their hormones, when their reproductive hormones go up, their immune system goes down. And if there are things that you can do, because male collectors want to stay in breeding condition all the time, because that's their natural behavior. But if you can get them out of that breeding phase, often the tapping will subside. So that's where sometimes I try to do a lot of behavioral manipulations, but I am one to go ahead and I will resort to using Depo-Lupron, and I also use melatonin in the water. Dr. Powers gave an interesting talk about how the melatonin acts to suppress the GnRH receptors in the hypothalamus. And I'm not using it to make the bird sleepy. I'm using it to reduce the GnRH release to stimulate FSH and LH in the pituitary. And sometimes those things combined with some of the types of behavioral modifications you can do can help this. But see, I would say, because if he's ABV positive, I would say that this could potentially still be contributing to why he's toe tapping. I would have said that. You don't, but I would have said that.
Yeah, but they need to run the antibody assay. Yeah,
Okay,
I would repeat that. And the other thing I would add to is gram stain exam, because
oh, absolutely.
I've seen a
And some
lot of
blood
these
smear minimal.
blood smear gram stain minimal, because I've seen a lot of these birds with staph diplococcus in the oral cavity, and that organism can be extremely allergenic, especially in birds like Eclectus. And oftentimes just a short, 10 days on Zithromax or Clavamox, and it clears them right up. So yeah, again, a good exam. Don't just pigeonhole these diagnoses. You've got to run the complete assay. You've got to run the AGAA, got to do the gram stains, got to do the CBCs.
So I guess the more we talk, the more questions we get in the Q&A box. So keep going.
Okay,
Bob.
so let's keep going. Okay, can I offer input regarding testing at the Ohio lab? We have a social media group, support group for ABV and AG. Some members have birds that are AGA positive that appear to be asymptomatic. Occasionally, birds are AGA negative. Client still feels the bird has avian ganglioneuritis. Okay, yeah.
Yeah, we talked about that.
Yeah,
we talked about that.
Some type of scale. Again, we're working on that. We understand the Italian lab results may be given as a percentage. Can we do that as weekly? I can tell if it's weak positive or strong positive. We can categorize it that way. We're working on a scale right now with it. But again, it's a matter of putting all this data in the computer and then putting the graphs up and, the interpretation. When you adopt a bird from a large rescue, do you recommend the AGA test? What other tests to make sure you aren't introducing anything into your current flock? Quarantine is a must.
Psittacosis.
Yeah, psittacosis is a biggie. It's still out there. Beacon feather is actually increasing. So if you've got a species that may be susceptible, we're seeing that increasing because a lot of people have just stopped testing for it. Herpes virus, Pacheco's, polyoma, not so much. Bornavirus, again, you've got to make sure you got a lab that's going to run a very sensitive assay, and you got to run 3 tests 2 weeks apart to make, to have any reliable indication that that bird is indeed negative. But then if that bird is positive, what is the chances that it's going to transmit it to another bird in that aviary? Pretty minimal. So I'm not saying to, bring a positive bird in, but
they're going to breed the bird. That's one thing.
Yes.
But if you're going to put it in a cage next to another bird, if there's no symptoms, no reason to test.
I'll make a quick comment here. We had a group of a pair of Kias where we had a positive male and female. We tested, they artificially incubated the eggs. We tested 22 of the eggs that did not hatch. 21 of those eggs were positive on the vitelline membrane for avian bornavirus. So this vertical transmission, I believe, is a major root. And we had problems with chicks that then survived, that hatched out about the time of weaning. About the time these birds wean, that's when their immune system becomes totally competent. And you got to add about a 2-week, 10 to 14-day period of time to develop the antibodies in that. And that's when we start to see clinical signs. So generally around the time of weaning is about the earliest that you're going to see it. We did histopathology on embryos in these eggs that did not hatch, and there was no indication that it was due to avian ganglioneuritis or bornaviral infection. So this autoimmune response is really needed to produce the disease there. So getting back to testing, you know, if you got more than 3 birds, chances are it's in your population to begin with. It's not one of these viruses that's going to go from bird to bird. If you are breeding birds, I think then if you want to make sure and try to have any degree of certainty that, you know, where you can go out and say, well, these parents were tested, you know, 3 times every 2 weeks individually, and they were negative on all these tests, then I think you can really say, you know, there's a pretty good chance these offspring are negative or we're not transmitting the virus. Not 100%, but it's probably the best you can get at this point in time. What's the best way to test our breeding pairs? Again, 3 samples, 2 weeks apart, testing negative to have some degree of certainty that the tested bird is indeed negative. PCR determines if the virus is present. Once a bird is determined to be of negative status, it will most likely remain negative throughout its lifetime, provided it's kept in a stable aviary environment and with other negative birds. You can have a positive bird paired up with a negative bird, and over time, sharing the same food and water and that, we can see this virus transmitted, but it's not readily transmitted from bird to bird. When you say stress can bring it out, could that be temporary, if slight, and once stress lessens, resolve or stop active disease? My comment on that is generally once stress starts it tends to progress until you treat it. Susan, you got to have an observation on that.
Yeah, I think I would agree with that. So stressors come in a variety of ways. And one of them is the breeding season and the breeding behaviors. And let's just face it. I mean, parrots most of the parrots that we own are 1 or 2 generations away from the wild. So they're still wild birds, and we put them in our home. So by definition, most likely they're going to be stressed. And so things that we can do to relieve that and to try to create situations for their natural behaviors to be exhibited will help with the reduction of disease along with some medications if we need to do that. Because now we're up to 20 questions that we haven't got to.
Okay, would an anti-inflammatory diet be beneficial? If so, what would it look like? Susan, you're more knowledgeable about that than I. I don't know.
Yeah,
Anti-inflammatory diets.
So first of all, you're going to try to go with an anti-inflammatory drug, and that we keep talking about COX-1 and COX-2 inhibitors. So we're talking basically about using Celebrex and Onsior, but from an anti-inflammatory diet, we're talking essentially, you know, birds in the wild will self-medicate herbally. So what I tend to do with these guys is things like milk thistle, dandelion, ginger, turmeric, devil's claw are all anti-inflammatory herbs. They can be given in the diet as well. So oftentimes, if you really have an issue, you've really got to jack that up. Chamomile, marshmallow, those are all herbs that can be added in for them. So you want to limit the numbers of sugars. So just as an aside, I was talking to Dr. Claesing, who I consider the god of avian nutrition, and I said, Dr. Claesing, what do you think about giving bananas? And there was this long pause, and he said, bananas nutritionally are a tube of yellow sugar. So I have to tell you, I stopped eating bananas after that point. And so that there is the vitamin K aspect to it, right? We don't know that it's related at all to vitamin K.
I would agree.
When you think about bolstering the immune system, you really think about vitamin A, beta carotenes. Those vitamins are probably more important. And then using ribavirin, you might want to comment on that, but
Yeah.
I think it was Susan Klug tried using it, and there wasn't much of an effect, if that's what I remember.
In vitro, when you're culturing this
Right.
virus in a petri dish on a cell culture, some of these antivirals will work. The problem is this virus again resides in the cell nucleus. These agents like ribavirin and so forth do not penetrate, to affect the virus there. So in vivo, in the bird, I really don't think they're very effective. And to date,
I did not have any effect. I did not have any luck with them.
no,
Early
to
on.
date, they have been proven to be ineffective. And then unless somebody comes out with an agent and an antiviral agent with a certain dose that shows effectiveness, I really have to say they're not effective. Back to your comment about vitamin K here, this question, I really don't know of any link between that and the disease. And I would really caution people about vitamin K and these fat soluble vitamins because you can induce a toxicity with them. So you need to be very, very careful. Can any veterinarian buy Onsior? It's
In the
readily
United States?
in the
Yes.
US, yes, it's readily available. And I think in Europe.
Injectable. Now, see, the point is for all of the viewers, you and I are using the injectable form.
Yes.
We're using the injectable form injectably. We are not using it orally. We're only using Celebrex orally. So that's what they need to distinguish, because there is the pill form of it too. And I have no experience with that.
I also have no experience with it. The bottom line is the injection is so effective because you're bypassing that whole absorptive mechanism throughout the lower digestive tract, the intestinal tract, where these drugs are absorbed through. You totally bypass that. You give the injection, it gets in the bloodstream and it goes to where it needs to go and does what it's supposed to do. When you give these drugs orally, they could sit there. And if you've got an abnormal microbiome, an abnormal digestive process where digestion and absorption is impaired, who knows how much of this drug is really getting into the circulation. So that's why we go to Onsior, and it's been very, very effective, very, very helpful for us. The once a week injection, I think is it's so convenient. And we tend to go with that, and we'll switch to Celebrex if we need to follow up, but that needs to be given twice a day, not once a day.
Right, and then I just want to say that Brenda reminded me that Dr. Stephanie Lamb did a recent webinar that you can look up on nutraceuticals. So, okay, I'm ready to move on.
Okay, so this question really concerns when you have an AG bird that's stable, when do you recommend stopping treatment? We have many group members whose birds have been stable with no symptoms for months, years, that stay on maintenance meds. My advice would be, we use the medication until we get the bird stable. After that, we'll follow up with a maintenance dose, maybe Celebrex orally, and then we stop. I don't like to keep these birds on these medications. I like to keep these medicines available for when we have a clinical problem. Again, we do not know the long-term effects of this medication. There's been a lot of speculation that long-term Celebrex will impact the kidneys. That has yet to be proven in avian medicine. I know of no paper that has shown kidney lesions due to long-term Celebrex, but still, I use these drugs when we need them, and I like to keep them on hand. If we do need them, we know they're going to be more effective rather than to keep a bird on it, continuously.
Yep. And so this is where, when I take them off, if we need to try something and keep them off of the Celebrex, this is where I'm using things like turmeric, ginger, and devil's claw.
Exactly. The nutraceuticals,
Right.
very safe, very effective. They're a really nice adjunct to the therapy. Okay, so let's see. I had a son conure that started wing flipping, making a cackle sound. We got 3 negative ABV results. Conure was diagnosed with diabetes, given Emerade omnivore, but it seemed like it was mostly sugar. Hated the Emerade, but I fed it. Then the bird started having stinky, bubbly poop and tested positive for Clostridium. Didn't know what to feed the conure. I know my Avian vet consulted with several vets, including you, I think, Susan. Necropsy showed normal pancreas. There was mention of possible ABV. It was less than 2 years old. I fed my birds carrots and pellets, veggies and fruit. Wondered if there's an optimal diet for a diabetic bird. Well, again, the ABV results, again, false negatives on the testing can be common depending how the sample is handled. This is an RNA virus. It's very, very friable. It doesn't last long in the clinical sample. And in this bird, probably the AGAA antibody test would be more appropriate. Obviously, this bird had a Clostridium infection, anaerobe in the intestinal tract. This stinky, bubbly poop, very common with Clostridium, which we will see associated with Avian Ganglioneuritis of the GI tract. A normal pancreas. I don't know how they diagnosed it with diabetes. Was this a blood sugar assay, or I'm not sure how they diagnose that. That's I don't know. Do you see that very commonly, and do you make that diagnosis very commonly, Susan? Because I really don't. Hello? Oh, I think Susan's gone here. Okay. Diabetes is really not that common in pet birds. They have a very, very high level of glucose, and that's just not a diagnosis that I see commonly. I think in this bird, obviously it was on a very good diet. Harrison's pellets, it's a good pellet. Veggies and a bit of fruit, that's a pretty good diet. Hey, Susan, you're back here. Optimal diet for a diabetic bird. I really don't know how they made this diagnosis on this bird. Had a normal pancreas on histopathology. Again, I recommended they probably should have done the antibody assay.
Yeah, okay, so here's the problem. So Emerade omnivore is not mostly sugar. It's
No,
it consists of some simple and complex carbohydrates, but it's balanced out from an amino acid and a fatty acid thing. So it's balanced kind of somewhat like a pellet, but not. It's balanced from that perspective in terms of fats, protein, and carbohydrates, but the carbohydrate is simple and complex. It's not just simple, which sugar is simple. Because I was one of the people that worked on this original thing. But the reason that it started having stinky poop is because it was designed for the critical bird that was emaciated. It wasn't necessarily designed for just to keep a bird on it for a period of time. Well, in order to get that the numbers of calories in a small amount of space, because of gavage, you couldn't gavage the huge amount. You knew what kind of a certain amount you can feed. You can only feed X amount to a cockatiel, right? And so what we did is we didn't put fiber in it. So in terms of the like there's a percentage of fat, and there's a percentage of protein, and there's a percentage of carbohydrates, and then there's a percentage of fiber. We got rid of the fiber because we couldn't give diantripeptides and isoamino acids, we couldn't make all of that work for that. So of course, over time, it can cause the Clostridium effect. So from the Conyers perspective, I would probably go ahead and feed it something that's highly digestible, a diet that can be highly digestible. Dr. Klasing made a couple, and Laura, you'll have to jump in here, honey, because I can't remember. I know that they took Ted had to take one of those. He decided not to do that, but you could easily use, if they have the weight maintenance diet, the Nutrien cakes. If so something like that. That is a little bit more digestible, but that one has more fiber. Okay, the Nutrien cake for the weight maintenance. So that would be something that you would think about for a diabetic bird. Now, and the neat cropsy showed a normal pancreas, and there was possible Bornavirus. And so I'm not exactly sure. So I can just tell you about from a diabetic bird perspective. So they're not truly diabetic. They're really hyperglucagonemic if they're a bird. So they have a glucagon problem, and it's manifested with high levels of sugars. So you want to feed more fat and protein. So I understand why the vet started sorry, out with the emerald omnivore, but they needed to add in fiber.
Fiber, exactly.
Yeah, and that's something that you have to do for these birds in general. These birds that have hyperglucagonemic, you have to have a lot of fiber. You have to have fats and protein and a little bit of sugar.
Susan, do you make a diagnosis of a diabetic bird very commonly? Because my comment earlier was that for me that's a very rare diagnosis.
Yeah, well, see, back in the day at the University of Tennessee College of Veterinary Medicine, all birds that were presumed to be diabetic got, a lot of them, not all of them, but a lot of them got shipped there, and we worked with Dr. Lothrop on looking at the whole concept of this problem with diabetes. Sun conure would be probably not on my list. You tend to see it more on cockatiels, toucans, things like that.
Toucans,
yeah, and there was, there were some pathologists when some of those birds were put to sleep. They looked at the pancreas, and there were definitely issues with the pancreas, and that's the other thing, is that the main part of the pancreas that the veterinarian takes out between the bowel loop of the duodenum, that isn't where you're going to find it. The cells, the islets of Langerhans are in the splenic loop. Okay, and that was some of the problems with some of the original studies that were done to try to understand diabetes in birds, because they took out that big part. We talk about the pancreas and the arms of the duodenum, right? If you're an anatomist, you like to use that phrase. But it wasn't that part that had the islets of Langerhans. Most of the islets of Langerhans were where those cells are, the glucagon cells, the insulin secreting cells, all that's in the splenic lobe, which is back farther, hard to find. So that, that's another problem. Okay, I think we should go on now.
Next one.
Questions.
Has information regarding findings with the AGAA in response to ONSIR been published? Well, I mean, we've presented a number of seminars. We presented this at AV talks. We did that chapter in Vet Clinics of North America on neurology. So there hasn't been a direct study, a paper, scientific paper on Onsior itself, but there's enough publication of it and other literature sources, for that. Should
And I
breeders
think
test their
Dr. Rossi,
birds?
maybe he has accumulated enough data now that he could maybe talk about that. But there's two factors about that. One is the response of the bird to Onsior, and the second problem is robenococci itself and the pharmacokinetic study. And a little bit of that was already done by the lab in Belgium, Ghent, at the University of Ghent.
Ghent,
But the
yes,
problem is that the doses that they used are pretty low in comparison to the doses that you and I are using. So then it
exactly.
kind of skews the data, which is a sad problem. Sad, but
Yes.
then you want to answer the question about the breeder birds, Bob?
Oh my gosh, that's a Pandora's box,
Yeah.
Again, if you got 3 or more birds, chances are you've got Bornavirus present there. Is disease transmitted via the egg? I think there's enough data to prove that. And
that's the study from Dr. Michael
Lurtz's
Lurtz's lab this spring. And yep. So that yes,
exactly.
the answer to that is yes.
Yes. And we really believe that's probably the major source that birds acquire the infection. And again, once infected, they're pretty much infected for life. It's just like herpes. Have macaw and gabapentin help control ABV symptoms. Should I also give her the shots? I assume that's Onsior, just flicking the wings and everything. So I'm pretty sure it's ABV. The shot stop the symptoms. Well, it's actually, do the shots stop the clinical signs? Symptoms are what a person will complain about, and birds really don't tell us what their clinical signs are. So these are not symptoms, but it says, if not gabapentin, what would you suggest? I would suggest, first of all, running the AGA assay. I have no information here as to what clinical signs, other than the fact that flicking of the wings. And again, you need to do that CBC and rule out heavy metal toxicity in that chem panel, because that is so important. Flicking
and
in
also
the wings.
Pain. We don't know how old this macaw is, so some of it could be pain, and so X-rays. Profile, CBC, look at for heavy metal toxicosis. And then, as Bob taught me, there's also this non-specificness. There's some non-specific, it might not be heavy metals, but there might be some other toxins. And by looking at the red blood cells, we can get a better understanding of that. So,
and
so
putting these birds on an oral chelator often really helps with the signs that we're seeing.
Right. So the GMSA is very helpful. Now with gabapentin, I'm a person who uses a fairly high dose of it. And I'm going to tell you that my residents, because I do resident rounds on Thursday night with them, they all said to me, "Oh, Dr. O, you're doing that thing with the gabapentin wrong." So you can't, if you try compounding gabapentin, it doesn't last long.
It doesn't work.
Yeah. So it may not work because the drug is wrong, or the dose is wrong, or it's the wrong diagnosis. So there's a lot of potential wrongs here.
Yeah, they're going to start at the beginning and work through it. Okay. Those are all the questions we had there,
so
but I'm sure there's more questions.
Okay, so Laura, shoot us with a question, honey bun. Give us a question.
Okay, sorry, I had to unmute myself. We got a lot of questions, like a boat.
I know. I know.
It's like we reloaded, restocked, and reloaded.
That's a whole nother seminar, webinar.
Yes. Okay. So let's see. Okay. So Laura had a question about. She says, "I'm familiar with Visbiome. Is that right? Visbiome.
Yes.
I'm familiar with Visbiome use and success with human GI illness. How should it be dosed and administered for parrots?"
We just got word that the liquid drops are going to be available here in the US and hopefully at ExoticsCon here in Denver next month. We'll have some information on that. We're in discussion. Susan and I have been in email discussion with the people involved there. I would think that that's probably going to be one of the best ways to administer it. There's a lot of these probiotics out there, but Visbiome is, it is really proven. And, this product's been in development since probably the 1980s. And there's a lot of positive information. I know Dr. Rossi demonstrated some really good effects with it. Also, Dr. Ganglioneuritis on hand-raising birds by adding it to the diet, the hand-feeding formula. And I would look at that liquid supplement being available here soon. Susan.
Okay. So the Visbiome is currently available, and I don't think you need a veterinarian to write your script. I don't know what they're going to do with Sevomix. So in order to get the product in the United States, Visbiome has one less of the original formula in it.
Two less.
Two less.
Yeah,
and then
less.
the Sevomix is got the original slab 55 mixture.
It's complete.
Yes. Yeah. So I've been dosing it as so I do about 1/8 of a capsule per day for a macaw. So if you use that as your guide, the problem is that the problem that all of you are going to experience that I discussed with Dr. Rossi and Dr. Ganglioneuritis is that the dosing that they have is pretty high. But I've been able to get away with this 1/8 of a capsule per day and have good effect with it. Next.
Okay. All right. Here's one asking if you can please explain the difference between your theory that there is an autoimmune response involved in the transition to symptomatic AG/PDD and certain, as compared to a handout some of our their Facebook group members have received from their vets that say that ABV is solely the cause of PDD. That high titers of ELISA testing likely confirm PDD, and low titers with symptoms should have a crop biopsy. So the handout recommends isolating ABV.
Gosh,
positive
who did that handout?
Wow. So that's the thinking inside the box problem. Okay. So it's the German. If Bornavirus is the only thing that causes PDD. It is it. That's it. And if you're uncertain, you do a crop biopsy. Because for God's sakes, you don't need to do a crop biopsy anymore. You just run a goddamn test with Bob. If you don't want to dust your sandals and learn, I don't know what to do with you.
Where did
basically
they get this
from? But the Germans are into it's this way or the highway type thing. I mean, let's face it. And so there's a lot of old thinking, and it's a power money problem is my perception on that.
I'm going to try to put a slide up here if I can real quick. And okay, here we go. Can you see that?
Not yet.
Not yet. You gotta do screen share.
Yes, no.
Hit screen share.
Yeah, hold on. I'm working on it. Let's see here. Okay.
There we go. Now
Okay.
There we go.
Yep.
Okay, but we got the wrong one. Okay, here we go. This was a study that Dr. Rossi did in conjunction with Michael Leertz, okay? And they took 28 birds that had died, and 4 of those birds had lesions of, back then it was referred to as PDD, okay? So of these 4 PDD positive birds, okay, they tested them. And they tested them for the ABV PCR. Again, 4 of those were positive for ABV. One of them had antibody for avian Bornavirus, but 4 had anti-ganglioside antibodies. And then you go down the list here, the negative birds, the birds that had no histopath lesions, 4 of those birds were positive on PCR. 4 of them were positive for ABV antibody, but none of them had an anti-ganglioside antibody positive. And they also had a group of 5 birds that were negative on PCR, but 5 of them were positive on ABV antibody, but none of them had positive avian ganglioside antibody. They had a group of birds with no histopathology, but 8 of these birds were positive on PCR. They had no antibody, but they were negative also on the AGAA. And they had 7 birds that were 0 on all of these. So the bottom line is Rossi observed 98% correlation between the presence of AGAA antibodies and the lesions of ganglioneuritis. Now, getting back to this thing that ABV is the only cause, the sole cause of avian ganglioneuritis or disease, that is totally unfactual, because I have spoken with a number of these researchers, Dr. Prasad and so forth. They have had birds where they can find the lymphocytic ganglion, plasmacytic ganglioneuritis on histopath. And when they challenge those tissues with in situ hybridization with antibodies to the avian Bornavirus, they cannot identify the Bornavirus in those tissues anywhere. So basically what that shows is we have a ganglioneuritis without avian Bornavirus present. So this handout saying that it is the sole cause, I think, is an error. It is a cause, but it is not the only cause of disease.
Wow.
Susan?
Okay, that was, you had the slide already. That was,
I had to look it up. It was there.
All right. So thanks for clarifying that. Next question asks if any of the imaging research that Dr. Scott Eccles is doing is useful in determining avian ganglioneuritis. So the work that Dr. Eccles has been doing with the imaging, is that?
He's doing some great work. Susan, you're more familiar with it than I.
So Scott and I have been talking about that. So I'm going to just leave you with this thought. He's boy, I don't know what I can say and what I can't say. Because some of it is probably proprietary. Let's just say then that what his level of CT analysis can do can help the veterinarian if they were willing to do his type of, injections of the contrast agent over the periods of time that he does it, as opposed to the slam bam, hurry it up, bolus type thing. And his level of micro TC work, CT work, because what Bob and I are trying to explain is that when we have these symptoms in the birds, not always is it Bornavirus that is the culprit. And so his work will help in that differential list of understanding what other things can happen. He is working on looking at the nerves and looking at the brain itself with his modalities. We don't have it honed to that point where he can actually see some of that, but he can give us information that can make us understand. For example, there was a cockatoo that gets more with feather damaging behavior, but there's a cockatoo Moluccan mutilating its chest. And so, because some of the times we're concerned that the mutilation can be a consequence of severe nerve pain from Bornavirus. But he found that the intervertebral foramina had kind of closed down because the vertebral column, the bony column itself was kind of collapsing down and pinching these nerves. So in this case, you know, there could be Bornavirus for the Germans, or it could be a combo effect where we have a structural problem. So there's a variety of things that's allowing us. So I love Scott, and we work together on a lot of this, and hopefully we'll get more information next year. I
Okay.
just should leave it at that, I guess.
Yeah, and if you have a chance, if you're watching today, we do have his previous webinars on the imaging that we're talking about. We've got some recordings on that, so it's an interesting one.
Pretty amazing stuff he's doing. Yes.
Yeah, our boy wonder.
Yes,
Exactly.
I know.
Our Nobel Prize winner. In the
I know. I'm
future
waiting
there.
for that. We'll have to have a big celebration when that happens.
Absolutely. Absolutely.
All
Next
right.
question.
So for the purposes of necropsy, what does wetting down the body accomplish? How wet does the bird need to be? And does this only apply to birds suspected to have AG, or does this procedure
any
apply to
necropsy.
all necropsies?
Yeah, so all necropsies, you want to wet the bird down because the body temperature of a bird is higher than that of a mammal. Okay, so it's about 105 degrees as a standard temperature, which is way too hot for a mammal. So that's why, you know, the whole culture thing, that Bob and I can talk about some other time about culturing birds versus dogs and cats. So they get hot, so they're pretty hot, and then they have feathers that are insulating and keeping that heat in, and all that causes the tissues to decay faster. So by cooling them off, by putting that water on them, and then the water, by wetting the feathers, it can't insulate, and then you put them in the refrigerator, then it cools the body down faster. Does that make sense,
Yeah.
Laura?
Okay, so I imagine cold water.
Well,
water's
actually,
better.
we tend to use a disinfectant solution
You can do that too.
because you know, you start doing a necropsy on a bird and you got feathers flying everywhere. And
Yeah,
this
except the
tends
owner at home probably doesn't have it. That's why he's
No.
suggesting that they
yeah,
do
wetting
that, or
them,
that
wetting them
they
down
can use
is
some
good.
alcohol, some
Cool 'em
diluted
down.
alcohol with cold water.
The sooner you get them cooled down, the better. Yes.
Yeah.
Okay.
Absolutely.
And-
Okay.
and,
Okay.
and you meant, sorry, just you mentioned refrigerator. Is there like fridge or freezer?
Refrigeration.
You don't want to do freezer,
No.
and you want to get the bird there within 24 hours. The sooner the better.
Okay.
The sooner the better. Like
Exactly.
like the necropsy right after you put the bird to sleep. That would be the ultimate. And even then you get a little autolysis.
Especially for the central nervous system.
And the GI tract, which are the
Exactly.
two areas that you want to look at in Bornavirus.
Agreed.
Okay. 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 So here's a question. Once you know that a bird has PDD/AGN, the flare-up subsides, the behavior returns to normal. Should they stay on meds for the rest of their life?
No,
We
They
talked
also,
about that. No.
No.
But they need to watch the bird very closely. If they start to see any clinical signs that can be suggestive of a ganglioneuritis, then I would reinstitute the therapy for a short period of time.
Okay.
Yep.
And then they had some other questions related to it. How do you know if the flare-up returns of symptoms/behaviors haven't reappeared even like at the 6-month visit that's done? So their 41-year-old bird just passed away. By the time they started the multiple visits, they found out post-mortem. The kidneys had shut down and basically the multi-system organ failure too.
yeah, so
How can that
birds
be
can die.
prevented?
What kind of
Yeah,
bird?
basically birds can die from other things besides Bornavirus.
Sure.
They can
Okay,
have
yeah, it's a
Bornavirus, or
41-year-old
they can
bird.
be AGA positive, but they can die from something else.
Okay.
What kind of bird?
Basically, they say multi-organ failure.
Yeah, that's
Bird
the
just shut down. What kind of bird was it?
I'm not sure if let's see if they can provide us that while we move on maybe to another question and revisit.
Okay.
Okay, so I have, this is another question. Adopted a cockatoo that was tested ABV positive before they got him, but isn't showing any signs. I know you said that there are different strains that different affect symptoms differently. Can he be tested to determine his exact strain so that they can watch more closely for those symptoms? It's a great question.
What difference? What my question to them is, what
Does not
difference
mean
does it
anything.
make? It doesn't mean
Yeah,
anything.
what difference does it make?
It's
Nothing.
meaningless.
Yeah.
Okay. Okay.
Just
And
go
the bird,
on, just enjoy your bird. And when it starts to have symptoms, you know that, then your vet then takes a sample and sends it to Bob's lab for AGAA.
Okay. Okay. And the bird before was a Moluccan cockatoo.
Yeah.
The 41, the
Makes
41-year-old. Yeah.
Yes, because he can die from something else.
Yeah, we see a lot of positive cockatoos.
Mm-hmm.
Okay. And let's see. So many questions. Okay. So this person posted last week to the Facebook AB group with pictures of their deceased macaw records. I believe she was ABV positive in spite of her EYP diagnosis. They spoke to the vet who processed the slides at the Department of AG and said he wasn't looking for ABV or PDD because the necropsy didn't indicate that possibility. They now believe that their other macaw may be ABV positive as her symptoms flare up when her hormones are raging. Please share again how often we should test her and submit those tests for AGAA.
Yeah, so first of all, you have a pathologist problem, right? Because
Yes.
you have a state veterinary pathologist who understands poultry but doesn't understand pet birds. So there's one problem. Then the next thing is, we got to think about the birds that are alive. Remember, unless that bird was in the same cage for many, many years together, eating the other's poop, they could be, and that bird could be negative, but it could be positive, depending if it over time was transmitted to this bird because the two of them were housed together. But I would, I tend to wait until the bird is during its the time. I know behaviors don't like me to talk about it this way, but when the behaviors, there's a lot of hormonal driven gonadal behaviors, that's the time I like to test them, because typically that's the time they're going to be, if they're going to be positive, they're going to usually be positive then.
And that's when they're going to show clinical signs. And those signs can be real subtle too.
All right.
Yeah, so that's when they want to do that.
Agreed. Okay.
Okay, so if a 22-year-old parrot has been perfectly healthy for her entire life, but for a minor GI incident 14 years ago, with 1 day of vomiting and bloody stool, which was diagnosed as Giardia and improved with treatment, has positive AGAA, do you consider her as having PDD? If not, is she greater risk of developing PDD due to the positive AGAA? She tested because another bird in the home has PDD, so that's why
Well, she's got avian ganglioneuritis. We know that. And Giardia. What kind of bird was it? Do you know?
Not sure. 22-year-old parrot. We'll get back to you on the species.
Clinically, I don't see Giardia that commonly.
Mm-mm.
I mean, all this bit about cockatiels, feather picking and so forth. To me, I mean, we looked for it. Rarely do we ever find it.
Really?
So
really.
That's really
kind of a red herring.
Interesting case. Yeah.
Okay. We'll see.
But again, this bird can have, so when her immune system isn't working, so that's why it's important to do a good job with the food, with basic husbandry, basic care, flying, because the more wing flapping and flying we do, because now we're going to start to have heart issues, right? Because we're 20 plus. It doesn't, in my experience, it doesn't matter what kind of bird you're talking about. A parrot species in captivity who sat on his butt for his entire life, he's going to have heart disease. And it's not because of what part of it is what you fed them, but a lot of it is based on the fact that, they were designed to be flyers, and it takes a lot of energy. So they tend to want to eat high fatty diets. And the reason they do that is because they got to work their asses off.
They burn it
flying.
out. Yeah.
Right. And but they're not. So their brain is still wired to wanting to eat high fat foods, and but they don't beat their wings enough, and they go, oh yeah, he flew down the hallway today. Really? I mean, are you kidding me? I mean, the bird should be flying for 2 hours in a day. I mean, that's what they would do in the wild. So so get those little birds out there and get their wings flapping.
Okay.
Great.
All right. Sorry. Let's see. What do we have next? Okay. This one is for you, Dr. Bob. What
Okay.
is the best way to get AGAA levels for 2 tests done at your lab to check if the parrot has been heading towards serial conversion? I believe our vet called your office a couple of times, but was unable to obtain the exact levels of ranges. They're not normally reported on the lab results document, but said that during a previous webinar that you could easily check and give us a much more precise answer.
Yeah, if they would email me or call the lab and leave a message with an email, I can research those levels out. Like I say, we're working on a computer program that analyzes the runs and we'll categorize them. But what we'll do is we'll put them on like a 0 to 100 scale, and I can take those 2 test results between our positive control positives and our normals that we run with every run, and we can tell whether it's increasing or decreasing. We believe these antibodies will persist for a pretty good period of time. I mean, we're testing for IgG, and those levels tend to last for a pretty long period of time. And even though clinical signs may regress with treatment, you may still get a positive AGAA, but if they can contact me individually, I can look that information up for them.
Okay. All right, we will do that. And then someone asked that besides Lafeber pellets and Nutriberries, what food and supplements do you recommend for a parrot who's only had GI symptoms, major constipation, but is not having a problem currently? Do you recommend Benebac, fruit or looser fruit for looser stool, other things diagnosed by a board certified avian vet? So major constipation.
Savoy.
What constipation in what kind of a parrot? Do we know?
No, I don't know what type.
Okay. Okay. So it's pretty rare for a bird to have constipation.
Agreed.
Right?
Yes.
And so that's kind of the red herring in the beginning. So I would bet from their description that the GI tract is not working normally, and so that we're not having the normal motility. So birds have a shortened GI tract in relationship to a mammal per unit size, and they kind of tend to use peristalsis, retroperistalsis, peristalsis, retroperistalsis, so that they can use the same small segment of their bowel. So those things could be off, and they can be off. And then the question is, they can be off for a variety of reasons. One is that they're older. That's a very common thing that we see with older parrots. They could have Bornavirus. They could have an infection that could be bacterial or fungal. If they're really bright and alert, I would agree, Bob, that there probably isn't any kind of virus other than Borna that would create something like that.
It's an eclectus parrot. Sorry, that's
okay. Yeah, and eclectus parrots, they're pretty odd, and their ecosystem that they come from is very different. They also do a lot of sitting around, and over time, just like the things that I think Scott showed you, that vertebral column, that there can be some kind of collapsing of the vertebra and the pinching of some of those nerves. So then the GI tract isn't moving appropriately because of there's some change in the nerve function. So that's one of the things that I would look at, where I pop the ultrasound probe on them and I watch to look to see if their GI tract motility is normal. I do gram stains, I do fecal directs, because I'm trying to figure out what is normal. Dr. Spear has a fluoroscope, for example. That's a great tool to look at that type of thing. So that's, and then you're asking me about foods. Well, if it's fungal, you surely don't want a lot of sugars, because that's going to just feed the whole thing. You want to have a good quality food with lots of fiber, so lots of fresh veggies, a fresh veggie chopped. If your casein is really, really high on balanced omega fatty acids, that most of the food manufacturers other than Lafeber are not great at balancing their omega fatty acids. That's important for GI health. It's important for the heart and for the immune system. So all those things would be things that I would think about when I work with that client with that particular bird. The other thing is, you know, Rob Marcel, we had a seminar with him through Phoenix Landing, and their GI tracts work a little bit differently. And a lot of it has to do with the relationship of the proventriculus to the ventriculus, that this motion isn't exactly correct, and they want to pocket stuff out. They pocket this caudal part of the ventriculus, and that tends to build up low grade bacterial infections, particularly Clostridium. So his way of dealing with it is a lot of fiber. He uses pear, and he does a lot of flying. He gets these birds out and gets them flying a lot. So there you go.
Susan,
So movement for bowel movement is kind of.
Yeah.
I'd like to add, you know, we can't ignore the microbiome. It is so
absolutely
important,
not.
so
Right.
important. And that's where I
Right.
think these products like Visbiome and Savoy are very, very important. We use them a lot in our practice. I think it's very imperative to include that management of the microbiome in these cases.
Okay. And then we had a question about in 2011, the gray was tested positive for avian Bornavirus. Positive result, retested and it was negative. This was with a fecal swab when it was first introduced and sent to the University of Guelph. I'm sorry, how you say that?
Well,
Should it
yes.
be tested again, or should they just let it be?
The birds got Bornavirus again.
If it's positive, positive.
Yeah, if it's
It's not like
positive, it's
voting,
positive.
you know,
You will get false negatives. If, you know, being the virus is in low levels, it's intermittently shed. Many times you can pull a sample, it'll be negative, or it can be in that sample in a low level, and by the time it gets to the lab, it degrades and it's negative. So if you got a positive, that bird's positive, and it will remain positive.
So you won't really have false positives.
No, false negatives, yes. False negative positives, no.
All right. Okay. Let's see. Okay. This next question. Their approximately 15-year-old Congo African gray has severe GI symptoms with abnormal barium study approximately 15 years ago. Perfectly healthy with Lupron shots as needed until one seizure after one prolonged seizure. About a year later, had a few more seizures, 100% controlled by Kepa. Dr. Laban retired, and the new vet, Laban.
Laban retired?
Oh, I can't believe it. What's wrong with him?
Come on.
So the new vet doesn't believe in triggers, but respects the owner's decision to treat with Lupron. So if just one seizure when stressed should Celebrex be used in the short period of time with Keppra? That's the question.
I'd run an AGAA on that bird. And if that vet doesn't believe in triggers, you know, for disease, they got to go back to vet school.
Right. So Jerry, I just, here we are, Bob. Where the hell is everybody going? Okay,
I don't know, Susan.
So I think that they might not need the Celebrex if the Keppra is maintaining it with the Lupron.
I agree.
They also need, because what happened 15 years ago may not be happening now. So they need to also look at it. Are we starting to seizure because our heart function is deteriorating? So there could be other reasons that they're seizuring. And so I would make sure that the heart is doing well. And that's, you know, going to take some x-rays and a nice quality echo that's well done.
I think this goes back to your comments about not pigeonholing a diagnosis. This bird needs an AGAA test to make sure that it is or is not avian ganglioneuritis. Keppra will work with some seizures due to AG, but Cipro and Robenacox have also worked without Keppra if there's seizures induced by avian ganglioneuritis. So again, I think you got to really work this bird up properly and, you know, try to define, you know, in more detail the diagnosis as to what's causing this bird's problems.
Okay. We have question about a pair of severe macaws that died from PDD, fern necropsy, in the early 1990s. So they raised a clutch of 3 chicks from them and still have one of the chicks. The male is now 31 years old. He has not exhibited any health issues, but who knows what may happen in the future. They've never done specific lab work or testing on him. Would that be recommended, or only if he exhibits the symptoms?
I recommend they keep this bird in the same environment that he's been managed in, low stress, whatever it is. You know, he may or may not be Bornavirus positive. Depends whether one or both parents are positive. Sounds like they both were. There's a good chance he's ABV, but again, you keep this bird in a suitable husbandry, you're going to minimize the effects of that infection, and he may never have you know, clinical signs in his lifetime.
Okay, and yeah, they asked if he passes away, is there a value to the research world if he's, you know, been both parents?
Again, you may want to run testing for Bornavirus to see if it's there, but it needs to be run properly, and I would make sure that they run at least the 3 different PCRs and on fresh tissue samples.
Okay, all right. Okay, here we go. My vet recommended a 6-month visits for my M2 Moluccan cockatoo that had PDD and inflammation, but seemed to clear up. Radiographically, it was back to normal. Should X-ray be done at those visits with the blood work as well to determine whether it inflamed but hiding symptoms? If you know it's PDD, is there a purpose in doing an AGAA test? If yes, why?
I
Yes.
think the AGAA is more pertinent to clinical signs. Although in cockatoos, if you look at what we see clinically, it tends to be more lower brainstem associated disease, and GI tract clinical signs are usually not in the
Minor.
picture. Yeah. But if you look histologically, you can find lesions in the GI tract on these cockatoos, but we don't see the wasting away like we see in the New World species, the macaws and the conures and so forth. So I don't know that radiographically that's going to help confirm your diagnosis. An AGAA, I would only recommend, well, I would recommend it definitely if you're having any clinical signs that can be related to a neurological etiology, then I would run the AGAA on the bird at that time.
Yeah, and the thing is, this proventriculus might be off because there's GI tract issues because the bird's getting older. Again, so we're back to the multiple, you know, just don't pigeonhole thing. Next, Laura.
Agreed.
Okay. All right. Let's see. They have many cockatiels in a group with PDD confirmed with AGAA. I know that Dr. Dahlhausen has said PDD is rare in cockatiels. Do you think we are getting more members with PDD teals because they are popular birds and often very hormonal?
I think they are popular birds, obviously. And again, in the past, I've said clinically, the birds that I've seen with it, the cockatiels with it, are I probably count on maybe 2 hands now. But saying that, last week I had a bird that came from another veterinarian that was AGAA positive and is wasting away. It's got, you know, looks like a typical macaw with PDDs. So I think probably part of that picture is the fact that with these birds like cockatiels, we generally don't see the degree of diagnostic testing, nor do we see the follow-up on histopathology if these birds pass. So it's probably a little bit more frequent than what, at least what I'm seeing clinically. I don't know, Susan, can you comment on that?
Yeah, I mean, that's surprising that they have a group of them that are positive. So they probably have, if they have a group of them, they probably have a pair or 2 pairs that are positive that are causing the problem and passing it on, because it's not. I tend to see green cheeks with it that tend to be a little wasting. So it's hard to say, but you know, they should probably end up running the AGAA test if they can.
You know, it was interesting because we would think that with cockatiels, we may see more CNS type signs, but in the ganglioside immunization studies that were done, these birds actually developed clinical signs that looked just like a macaw with typical PDD, enlarged proventriculus and so forth, in the wasting away. So
sorry, I need to. Sorry.
Go ahead.
Just to clarify, sorry, when they just got a little bit clarity on this, but when they mention group, they mean they're part of a Facebook group. So these are all different owners. I'm so sorry. Yeah, I hope.
Okay.
So sorry. I said group.
Whoa.
Yeah, I was wondering because it's rare for me to see a group of cockatiels with ganglioneuritis, you know, where they're all showing signs.
Between group and group, right?
Yeah, yeah. I mean, you can see them, but it's not common.
Next.
Okay. So Dr. Bob recently diagnosed their Eclectus max with AG, and we are treating them. How often should he be tested? Also, do we know enough to prevent this from passing to the egg?
Are they breeding this bird?
It must be.
Yeah, I'm gonna guess.
Then they shouldn't be.
If this is Max the Eclectus that I know.
Yeah, I think so, because
yeah, they're not breeding this bird. So
yeah, but if they thought as for the other people out there, they shouldn't be breeding it.
I wouldn't recommend breeding them, no. And as far as I know, Max is doing pretty good now. So with treatment.
That's the thing. It's again, you know, treat them when you need to and back off when you don't need to. That's the same thing.
100%. Yes.
Yep.
Okay. And this question is from Dr. Soga in Japan. Why is it so common that when a bird is in heat, it develops Bornavirus?
Because so what I think is it's a trigger. So that when the hormones go up, that's the trigger for the virus to start replicating. So they can be transmitted sexually. It's transmitted in the egg.
Yes.
Or it might be, we don't know enough to know if it's transmitted in semen. Do you know that, Bob?
I believe it is, although there's not a published report on that.
Okay.
Some of the work in Germany, I think, indicated that it was, although that was just a comment that was made. So we got to wait for the publication on that. But getting back to these birds that are in breeding condition, there's a certain suppression that occurs with some of the host immune system during the breeding season. And we assume that that's probably keeping this virus in check. And then so that will tend to allow the virus to, activate and multiply. So I think for that reason, then we tend to see a greater occurrence. Plus stress with your adrenocorticoids and so forth also tend to do that. So I think for those reasons, we tend to see a greater incidence of it during the breeding season.
Okay. So the next question, they say they've just taken in a green-winged macaw, presumably about 10 years old, who is ABV and AAG positive. He's asymptomatic other than being profoundly gaunt. He was 834 on intake and now he's at 920. However, he doesn't have the rapacious appetite with no weight gain that you would think is typical. They're working on that right now to try to get some weight on his frame. He's normal size, just very underweight. The
bird is really thin. He's got a GI tract that's not functioning normally. He's AGA8 positive, ABV positive. This bird needs to be treated for ganglioneuritis. He's showing clinical signs.
So the point is, though, even so, in my hands, when I would treat him, I would, I'd probably give him Depolubron, melatonin in the water. I'd treat him with some Onsior because his GI tract isn't functioning right. I want to take some X-rays to see what the proventriculus and the ventriculus look like, because I don't have Dr. Spear's fancy dancy fluoroscope, which would be a nice thing to have. But then I would try to give him some of the Lafeber critical care diet, the omnivore, because it's elemental. So those are some of the things that I would do. But be that as it may, many of these birds, because of the persistence of this virus, that chest musculature may not improve.
Agreed.
He may get brighter and act better over time, but they can't expect that by treating him, he's going to get robust. He probably will not.
Okay, and they
Yeah.
did comment that he is being treated.
Yeah.
And so they want to see how they,
Yeah. So
The
the problem
important thing is he's not losing more weight. He's kind of stable.
yeah, and you can't
That's
just
what
load
you
them up
need to
on
do.
fatty foods, is what they're right. You can't.
Exercise too. Once they get him stable, mild exercise, I think it's important too, along with diet. Yeah.
And then this is another thing where I found that the Stevo mix is helpful with those birds. So that
Yes.
might be something else they can try in their treatment.
Okay. Okay, and then the last question is about melatonin. Their green wing macaw is struggling with hormones. The vet gave her the implant, and they mentioned melatonin to help with symptoms. She's not familiar with the dosage. Could you provide information about dosage on how she can obtain information?
Not off the top of my head, I don't remember it.
I don't either.
It's in the paper that
Laura
Powers wrote for AAV, but I have that at the practice, but that's one I don't keep in my head. I don't honestly know.
Okay.
I tend to use the NOW products and Now Company's products, and I use their non-alcoholic tincture of their melatonin. There's a little bit of one of those sugar additives that you don't like, but it's okay, honey. It'll be fine.
Gaia is pretty good too. Gaia herbs.
Yeah.
Okay.
I don't know, Bob, do they have a melatonin product?
I assume they do, but I do not know off the top
Yeah, I
of
don't
my head.
know.
I mean, that's something I imagine you want to make sure you have properly dosed, right?
Yeah, it's got to be properly dosed because they can get sleepy if the dose is too high.
Yes. Agreed.
All right. Wow, you guys just breezed through all those. We had so many questions in the queue, and you guys just breezed through them all very expertly.
And now since there's two more though.
Oh, so you want to clear it? You want to clear the queue, right? Is that what you're?
Yeah, we want to clear the queue.
Oh, you know what?
We want
Actually,
to go on to a new subject.
well, actually, I just opened up the Q&A, and one of them is like, "Thank you." It's a thank you.
Oh, okay. Thank God.
Well,
and
Okay.
that you saved
thank
their
you.
bid. And
Thank you for watching.
Yeah, so those are basically kudos.
Well, our goal is for veterinarians, veterinary students, owners to have information and an understanding to make the lives of their birds better. That's what we're all about here.
Agreed.
And that's probably
yeah.
why Bob and I are still working. And Jerry LaBondi is retired, for God's sake.
That word is not in our vocabulary, Susan.
That's not in there.
You guys are carrying the torch for.
All right.
That's awesome. I mean, seriously, like just the amount of time that you spent with us today and answering all those. I mean, I don't think we've ever cleared the the Q&A queue with so many questions that we were stacked with. So that was a first.
Well, thank
you. Guys are determined to get through every single question.
And we appreciate all of them, staying.
Exactly.
There's the
Over
staying
2
power
hours,
aspect
yeah.
to this too. I'm sorry I had to get up and leave for a few minutes because I had to deal with dogs and stuff, but it was okay.
That's funny. Someone said thank you for do not retire. There you go. All right.
Okay,
I have to
until we meet again.
I have to announce our winner. We have a giveaway winner for today. Yeah. It's the Lafeber the new foraging packs.
Those are nice. Really nice.
Like a nice sampling of the foods and stuff. And so that is going to go out to Pam Skidmore. So congratulations, Pam. Hope you and your bird enjoy dining on that foraging. So, and just to tell everybody, next week we will be back with Dr. Tom Tolley with Ask the Vet. So we'll see if he can get through the whole queue because you guys showed how it's done here. We get a lot of great questions. Oh yes, And a big question for you guys is, if you're coming back to cover a big topic, feather destructive behavior, that would be.
We can
Yes.
arrange it. We can arrange it. Yes.
Yeah,
All
well, I
right.
think we're working on that with Brenda.
Yep. Yep.
Great. Okay.
All right. So there's something to mark on your count. We'll have that information out as soon as we book a date and get that topic on our calendar. So I'm sure we'll have probably even more questions for that one. That's a big one.
Well, thank you,
Again,
Laura.
all right.
We
Thank you guys for
appreciate
it.
joining us. Very appreciative. Everyone
you,
have a great
Susan.
weekend.
Thank
Thank
you, Bob. Everybody have a great weekend and enjoy your birds.
Yes.
All
Thank
right.
you. Thank you so
All right,
much.
bye now.
Bye-bye.
Bye, guys.